Surgery for thyroid orbitopathy is a very good option for the person that are affected by this anesthetically problem. Thyroid can cause major problems to our eyes specifically. We need the endocrinologist to take care of our thyroid, but will that take care of our eyes as well? In most of the cases, not. Our eyes follow a different path. Some will get back to where they were, don't need any specific treatment, but many will do. What happens to the eyes? They pop forward, becoming more bulgy, more bigger, and especially frequently this is associated with an increased aperture of the upper lids called eyelid retraction. So combining these two things happening at the same time, so the eye popping forward and the upper lid getting bigger, now we can get really a major transformation of our face, of the way we look. And if we look at the patient affected by thyroiditis, thyroid esophthalmos, the way they look before and the way they look after this illness, they don't even look the same person. So that's natural that these people come to see us seeking improvement for aesthetic reason and functional reason. Because not only they don't look as good as they looked before, but this condition is also associated with discomfort, redness, dry eye, difficulty in closing the eye, and sometimes even worse. So the functional and the cosmetic go together in this condition. And the solution is surgery. If we don't do surgery, once the thyroid state has been treated and has been stable, the patient will never change. Either they will accept a new look or they will have to do something about it, and that something is surgery. Surgery, the way I see it, is aimed to address all the issues that occur because of the thyroid. Specifically, correcting the esophthalmos, correcting the eyelid retraction, and eliminating the swelling, the puffiness that has been created by this important disease. We tend to do this the correction of these different things at the same time in the one procedure. We do the procedure to both eyes, and what do we do to bring the eyes back is called orbital decompression. We make more room behind the eyes where we have available room lying in the empty nasal sinuses, the maxillary sinus and the ethmoidal sinus. By enlarging the spaces here with small and, let's say, relatively delicate fracture of the very thin bone that cover these sinuses, we can make our orbit bigger, and so the increased volume behind our eyes in the fat and the muscles can occupy this newly created space and go back, and the eye will follow backwards. This procedure, the orbital decompression, is performed without visible scars under general anesthesia, so it's not painful. A little discomfort waking up for the first hours. Associated to this, we try to address the upper lid retraction when present, and by placing the eyelid at the position where they should be, and combining it with a blepharoplasty, upper, and lower, all together, depending on a case-by-case situation. In the end, roughly a month after the procedure, the patient will look a lot like what she was used to look like before having had the thyroid eye disease. Especially even if not perfect, she will look so much nicer that she will not need to use the shades anymore to go out or to bear or to stand those funny looks that people will give us to our sterile look. And with this significant aesthetic improvement for thyroid eye disease go the improvement of functional as well, so a patient can close better, they don't have any dry eyes anymore, the eyes look white and not red, so a combination of better feeling and better looking much more normal, if not exactly the same that we were. So there are nowadays less invasive solutions that don't leave any scars, that you can go back to work in 7-10 days time to address these important changes caused by thyroid disease.